Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center. We have the Ask the Doctor Anything every Tuesday at 6 o'clock to 7 o'clock, where you can type in a question in the live chat that we have here on YouTube. And you can type in at tlcdoctors.com and you can type in your questions on the email link that we give you if you're on our weekly mailing list, tlcdoctors.com. We'll send you a notification, and on that link, you can type in the questions directly for our weekly Ask the Doctor Anything. So we are here and we're working this Tuesday from 6 to 7, as we do every Tuesday, 6 to 7, as a service to our patients and our family and friends, trying to just look at a functional, integrative way with all the experience we have over the past. I've been practicing 43 years in general medicine from a functional, integrative, complementary, alternative point of view, mixing the best of our medical allopathic training with the best of the integrative functional medicine history that we have for many decades. We have 6 or 7 of us healthcare providers here, and we are trying to raise your health and raise your awareness about how you can empower your own health with your own activities as far as lifestyle. We can guide you in that, and maybe certain nutraceuticals that would be beneficial, certain lifestyle circadian rhythm training, personal lifestyle hygiene that can work towards these goals. So if you have any questions, and if this is a help to you, please like and subscribe. That helps us to get this out to more and more people. So we will start with some of our questions from our email. The first one I have is from Catherine. And Catherine says, I'm doing the chelation IV treatment. Would this have a positive effect on my memory and word recall? I don't seem to have to search for my words since using this treatment, and just wondering if there's a correlation. Thanks. Well, Catherine, thank you very much for asking this question and giving us an update on your state of health well-being. The answer is indeed yes. Chelation therapy is a means for improving the microcirculation, not only to your arms and legs and heart, cardiovascular system, also includes the circulation to your brain. And when you have better perfusion, you'll have better cell membrane repair to all of your central nervous system. And this will enhance your recall, your memory, your sharpness. So I'm in my 70s and practicing full time, and I have to stay up on a lot of things. I also think being better hydrated, being on natural hormones, getting a good sleep, doing exercise, eating a low carb diet, eating a diet that is whole food, avoiding processed food, not eating late, all these various things, and in fact, systemic enzymes with certain nutraceuticals helps with your memory as well. But indeed, that is a benefit that we see, and I've seen for decades with EDTA chelation. We have patients who came here with the chief complaint of memory loss, dementia, Alzheimer's, who were already on medications like Aricept and certain other memory promoting medications. We have done all the things I suggested in my statement so far, along with the chelation therapy 2-3 times even a week. And we have had these people turn around and not lose their job or not lose their ability to function. I suppose if it's terribly far along, there's a point at which there's no return. But the vast majority of people are with early onset dementia, Alzheimer's, starting their medications. These are the people who especially should be doing EDTA chelation therapy. That's ethylene diamine tetracetic acid, and we use the dicalcium calcium disodium, calcium disodium EDTA. And so thank you, Catherine, for saying that. The next question is from Sherry. She says, I'm confused on which probiotic I should be taking. There is the regular probiotic and then the probiotic 100. I do have Crohn's, so I would want the one better for me than the other. How many do I take? Thank you. It's a little more difficult, to say, Sherry, without knowing more about your state of health. Just to say you have a history of Crohn's. We would want to look at someone who has done a complete digestive stool analysis. That's where they do this broad, evaluation of the digestive factors, the short chain fatty acids, the predominant flora, the dysbiotic, the imbalanced flora, the yeast, the white blood cell, the inflammatory components. We would want to look at your blood inflammatory status, your biomarkers, any other comorbidities, your blood sugar levels, insulin, your total white blood cell count. We would want to look at many things such as this, along with then making a decision about what probiotics, what prebiotics to take. In general, bifidobacteria, lactobacillus, these need to be significant in the numbers in your count, which are screened on a complete digestive stool analysis. And as we learn more and more about the thousands and multi-trillions of bacteria and flora that is in the contents of the bowel, we're starting to see that bifidobacteria, when it's too low, we saw studies by Dr. Saban, and she wrote the book, Let's Talk SH''T. Let's Talk SH''T. That's the title of her book, Dr. Shaban. And she noted that during the alleged COVID time period, those that had low bifidobacteria were the ones who were susceptible. So in a family unit, for instance, if someone was diagnosed with COVID and they got their stool sample, they would be low in bifidobacteria, but those in the family who, let's say, had high bifidobacteria, they did not succumb to the infection. So these and other probiotics we're learning are very, very important. So we like to pick a probiotic that's rich in bifidobacteria, of which Orthomolecular's probiotic is rich in that, as well as the lactobacillus and some other strains. The probiotic 100 is just a higher dosing, really, of these as far as billions delivered per serving. There are other probiotics out there. O'Hara's Essential Probiotics tends to have some of the gram-negatives strains in it. And then there are other probiotics that are spore-forming. Orthospore IG is another one. So we want to look at where you're at in your Crohn's disease to come to a decision. If you're doing well and you're just pondering this without any severe symptoms, I would suggest to you to take one of the orthobiotic because the company matters. The people who make this, you have to have high quality. This is a difficult thing to produce. So orthomolecular has high standards, and they put out their orthobiotic called probiotic, and then they put out the orthospore IG. I would take it one of each, and that would be my maintenance. If you have any exposure to antibiotics or illness, I would maybe double or even triple the dosing during a period of stress in your life. And then and the only time I would take O'Hara's essential probiotics is if we found that there's some of the gram negatives that seem to be diminished as well. Hopefully that helps you, Sherry. Barbara asked the question, what studies have been done regarding the effect of having bypass gastric surgery and having an effect on chronic fatigue syndrome, if any? What studies have been done? I don't know, Barbara, if I could call to mind a study in particular. I'm very familiar with gastric bypass surgery. There are modifications of the type of gastric bypass surgery over the years, but essentially it's doing surgery on the stomach and making a much smaller pouch for food to come in. So the volume of food is severely restricted. You cannot take the volume of food in that you had before. And then this deletes a certain portion of the volume of the stomach, and it then, so to say, skips over some portion of the digestive tract. When that happens, you can have certain mineral and nutrient malabsorption syndromes. There's a thing called the dumping syndrome. There also is problems with scarring or adhesions, partial or complete obstructions, and the need for redoing surgeries. So if anything that I've seen over the many decades that I've practiced, and they've been doing gastric bypass surgery, at least to my experience, since the 1980s. My suggestion is that it is the nutrient vitamin malabsorption that is associated with the fatigue that often, and how often would that be? I'm going to say my knowledge of this is in general that most people maintain their weight loss, at least about 50% keep the weight off to a significant degree. So the majority tends to be successful as far as weight loss. The number two thing is maybe, 15% to 20, maybe 25, suffer a syndrome of some kind of fatigue. And that I usually attribute to the poor nutritive absorption that the patient suffers from the decreased volume, the difficulty trying to get in a good nutrient absorbable amount in such a small pouch for a stomach. In particular, it's very difficult to get the phospholipids from meat, chicken, fish, pork, but especially meat, one of the most nutrient-dense foods. Then the blood type matters because the secretion of digestive enzymes and acids, and then the need for those acids and the production of intrinsic factor for certain B vitamins and absorption becomes diminished. So you can see a cascade of problems develop. I would give my patients a methyl B complex rich in thiamine, the multivitamins. Our thiamine has 50 milligrams of thiamine in it in our TLC methyl B complex, or orthomolecular's methyl B complex. Both also has 50 milligrams. of thiamine, so a very good dosing of the B vitamins. And then I would probably supplement with some amino acid powder, like perfect aminos with the branch chain amino acids. And I would have them take a digestive enzyme with it. I would also have them use the IVs to get a IV of nutrients that bypasses the stomach as well, so that they recover quicker, they get their energy back, they get all the B vitamins. We just had our clinicians meeting today, and I brought up the fact that Dr. Dietrich Lonsdale, Dr. Dietrich, or Derek, excuse me, Derek Lonsdale, Lonsdale. He was a medical doctor from Cleveland Clinic, a pediatrician, was practicing since the I would say 40s or 50s. And he just died, I guess, a few weeks ago at 100 years old. And he was very popular in the study of B vitamins and energy production in the human body. He promoted especially the knowledge of thiamine. Thiamine is vitamin B1. And thiamine is a cofactor in many of the steps that it takes for foods, the byproducts of digesting fats and proteins, amino acids, and glucose to get into the cell engine, the mitochondria. You have to have thiamine as a key cofactor in that transport of these energy elements in our diet to get into the mitochondria, to go through the carboxylic Krebs cycle pathway to generate ATPs. And there are many sites that it's needed. So if you are low, you may not know that you are vitamin B1 thiamine deficient to a severe degree to be diagnosed with, like, the disease beriberi, Beriberi. But you may be suffering pre-clinical symptoms of beriberi, such as chronic skin rashes, seborrheic dermatitis, anxiety, palpitations, maldigestion, reflux, constipation, diarrhea. What else? Tingling, paresthesias, mood, anxiety, all the things that are associated with the diagnosis of a real thiamine B1 deficiency, which is dementia, dermatitis, and diarrhea. The 3 Ds of a thiamine 1 deficiency. And you don't have to have all those, and your doctors may not even think of this at all, no matter what specialty. If you're seeing a cardiologist for palpitations, or you're seeing a dermatologist for your skin, or you're seeing a neurologist for your tingling, or you're seeing a psychiatrist for your mood and anxiety and your mood swings. And all that can be precipitated with maldigestion, and this not infrequently from post-surgery from gastric bypass. So I would try and find a good functional medicine doctor who understands these principles, that can get you with a nutrient producing facility like Orthomolecular. There are probably others, but over the years, I have visited several times Orthomolecular. I know the owners and the scientists there. Very high moral, ethical people, and their quality is very, very good. Therefore, I use their methyl B complex, and we have our TLC methyl B complex. And I would be taking that along with a digestive enzyme. When I eat, I would take the perfect amino acid powder. I would take the mineral TLC methylated albion amino acids. I would take the D with K2 fat soluble vitamins. And that would be my beginning prescription for someone on a gastric bypass with chronic fatigue syndrome. Why? Because if you can't get energy out of your mitochondria, and remember, I think I've spoken in the past couple of visits about the uh, infrared red light therapy, or the rising morning sunrise, long waves of light that go right through our skull and our bones, our eyes and our clothes, to reach the structured water enveloping every cell of our body, to increase that exclusion zone that hugs every cell membrane, which is a negatively charged water area that has a positive proton layer next to it that creates a polarity for energy in the human cell, the plant cell, and the animal cell. So we have both water and sunlight and healthy mitochondria, all to help us make good energy. And you need to work with doctors that have a multidisciplinary approach to the concept of why are you tired. Hopefully that helps you, Barbara. Carrie says, is there any downside to using creatine as part of my daily diet? And my answer, Carrie, is no. I've been around functional natural nutritional medicine for decades now. And I know people who have taken hefty amounts, 10 grams a day for years and years and years, and they've done well. If they had kidney disease or liver disease from some other cause, I'd probably watch them more closely. But even those who have challenging comorbidities have done well with extra creatine to build up muscle mass. Because you're not going to get well if you don't move and exercise your muscles. So I'm going to say there's no downside to my knowledge of using creatine a part of your daily diet for years and years and years. And I can specifically say, 10, 12 grams easily should be fine for long-term use. Alexis says, hi, Dr. E. Dr. Meric and my integrative GI are treating me for SIBO and SIFO. Just confirmed mold in my home and need to remediate. Can you recommend an integrative PED to help detox my kids? Oh, an integrative pediatrician to help detox my kids. No, I don't know of any integrative pediatrician. Sorry. Would you recommend chelation for mold mycotoxins generally? Any other advice appreciated? God bless you. You have to remember, from my point of view, ever since I was 7 years old, and that's 64 years ago, I have been around EDTA chelation people. And I started receiving EDTA chelation when I was 16. So I am going to tell you, I have such tremendous great respect for what calcium disodium EDTA does for the microcirculation, the aeration, the reduction of the acidity, the reduction of oxidative stress from heavy metals, allowing the immune system recovery and better performance to get rid of viruses, bacteria, fungi, and molds. And so I am trying to remind you also that the exposure of heavy metals when a mother gives birth to their child, if we take a sample of the cord blood from the placenta, the concentration of serum lead or serum arsenic or serum aluminum or serum mercury will be almost 50% higher in that cord blood. So the babies become something that mothers detox into. So every mother will shed her heavy metal burden to some degree into the child, which means the beginning start level of exposure of heavy metals is in birth and development, conception. So I really believe that pediatricians need to take this seriously and look at the amount of heavy metals at birth in the cord blood and track the blood levels in the child and look more seriously at any proposed uh, injections that have aluminum or mercury in them to add to the burden the newborn or young infant or toddler or child is being asked to be exposed to, because those are immunodepressant and disruptive, associated with chronic disease. And this has to be followed. We need funding on this. We need informed pediatricians and obstetricians to start tracking this. Again, mothers will detox into their babies. Cord blood, therefore, is known to be much percentage-wise higher than in the serum blood of the mother at the same time. This is a study that needs to be tracked and done. And then this is associated with poor immune system, which puts you at risk for mold and other immune disorders as well. So I'm in favor of childhood detoxification with EDTA chelation. Of course, we gave it to the little children at Cook County Chicago Hospital that ate lead-based paint chips and became GI and neurointoxicated, even some to the point of death. We gave them that wonderful chelating simple agent, and then they survived. I think a nice way to do this for children is with a suppository, and can be easily done. Getting away from all processed foods and on a real food diet. I believe in breastfeeding as long as possible. And of course, mothers should eat a rich, healthy, real food, non-processed diet and be well hydrated. And so these are the directions I would take a child and work with them on their exposures to what we see today as far as challenges that make them more susceptible to their environmental challenges that we all are facing every day. Lisa says, hi, Dr. E. In April, you increased my estradiol, and in August, Dr. Kaur increased my progesterone, all to help eliminate continual bleeding. Now I feel like my clothes are fitting tighter. Is weight gain a side effect of either of these changes? Well, then I would ask the question back to you, Lisa. Is aging associated with weight gain? Is there a trend for people with age to get mid-life bulge, for age to be associated with muscle loss? Aging is associated with gaining weight. And the use of hormone replacement therapy is wrongly lambasted as the blame for this. If anything, hormones should make you feel more vital, more energized, and have a better metabolism, helping you with your normal repair and regenerative processes, so that if you did exercise and you did weight resistance training and you did wake up in the morning with more vitality, this would resist weight gaining. So I am going to put a negative to that suggestion that hormones cause or are very much correlated with weight gain. Rather, I would say aging and the stress and the cortisol of aging is associated with that, and our loss of muscle mass with aging. Constance asks the question, do you think SuperBeets supplement is good for someone who wants to wean off of high blood pressure medicines? He had the AFib ablation surgery done 5 years ago. He's a male in his 50s in super great shape. He works out 5 to 6 times a week. I told him to start with eliminating his gin martini every day and weekend indulgences before taking SuperBeets. Well, SuperBeets have nitrates in them that are associated with making more nitric oxide, and nitric oxide production is associated with vasodilation and vascular perfusion, and performance is always a healthy thing. But it is not something isolated. I am not saying any one vitamin. It's the whole plethora of a healthy lifestyle functional approach where you drink enough water, you wake up with the sunrise, you get outside, you let that morning sun penetrate your being for a few minutes, and you let your feet be in the wet grass, and you earth or ground with the uh, negative ions of the earth. And then you eat a low carb diet, and you eat a diet that you're made of protein and fat. So you eat plenty of protein and fat, and reduce compared to the average American trend, where nearly 70% of the uh, calories of the diet every day are from carbohydrates, processed foods. So we have to seriously look at that. Of course, it looks like he's handling the exercise. We have to understand, um, you know, if you have alcoholic beverages and you think about it often, or you're planning your day around obtaining it, or you're not able to walk away with it from it without feeling loss or withdrawal, then addiction patterns are becoming a concern, a dependency. And we can do that with carbs and worry about where am I going to get my treat, and making plans and driving late at night to get your pint of ice cream. Or we can make plans for all kinds of things that can have addictive patterns. So alcohol is just one of many things. We all have to look at how we are dealing with it. It is a toxin, and if it's a daily thing and more on the weekends, I would be cautious with that, because that is toxic, and it will impair liver function, and it will be associated with, you know, cardiovascular and cardiomyopathies, and potential other hazard exposures. So I would say be gentle, be loving, and modest in pointing this out to your friend. And I would not say the beets and their carbohydrate exposure, because it usually comes as a beet juice, is a good way to deal with things. Exercise in and of itself is a great nitric oxide progenitor, along with a healthy volume of water consumed every day. So I think that SuperBeets probably is more hyped up as a supplement idea than anything else. There's L-citrulline, L-arginine supplements. I would say most of this is just making sales to get nitric oxide. I would exercise. I would do both aerobic and weight resistance training at least 3-4 times a week. And I would drink plenty of water and go to bed on time and eat a low carb diet. And you'll probably do just as well. But you see, there'll never be these paid studies, and it's too hard to follow lifestyles and people's secret life and cheatings that we do. And we lie to ourselves about being, I'm a carnivore, or 100% low carb or no carb. And in fact, we are so forgiving to ourselves, and we cheat. And then we really are not biochemically having the impact of what we claim to be our true carnivore or very low carb diet. We're humans, and we just got to love ourselves and encourage each other to the best we can be and the kindest we can be to each other for our health benefit. Sally asked the question, will you please explain the difference between the FDA-approved bioidentical hormones versus the compounded, non-approved FDA hormones? I don't think there are non-approved FDA hormones. I think, well, let me just tell you my take on hormone replacement therapy. You can't patent estradiol. It's a natural biological entity, and we cannot patent it. So the pharmaceuticals pretty much will have nothing to do with it. Therefore, we can get true female human estradiol. But many years ago, in the 40s, 50s, 60s, we were largely using a marketed pharmaceutical equine or horse-derived female hormone. So that was in Premarin. If you recall those old tablets, Premarin and Provera, which was a synthetic copycat with modifications in the molecule to make it progesterone-like. The birth control pills are just full of this synthetic modification to claim patent ownership of the molecules that mimic female hormones and mimic the estradiol, mimic the progesterone. But there is only estradiol and progesterone. Women do make a dimer called estrone and a very little bit of estriol, but these pretty much are not a issue. It's the female bioidentical estradiol you want, and that's readily available. And you can get that in a pill form called Estrace as a 0.5, a 1 milligram, and a 2 milligram tablet. And you can get the patch there's various names of the estradiol patches in various strengths. And then you can have estradiol itself mixed into creams or mixed into pellets that would be injected under your skin, which I never recommend pellets. And these are all human bioidentical. It's the progesterone that really the Women's Health Initiative of 2002 came out in July 2002 that used the progestin as the fake progesterone. Interestingly enough, in that study, they did have an arm with natural progesterone in it. And it was the progestin, the synthetic progesterone, that was associated with breast cancer prevalence. That Women's Health Initiative really didn't do anything to challenge the safety of natural hormone replacement therapy. And a study that came out in 2022 by the author of the book, Estrogen Matters. I don't recall his name, but a doctor wrote the book, Estrogen Matters. And he did a retrospective meta-analysis of all of the human studies on women who had had breast cancer and then went on natural hormone replacement after breast cancer surgery from 1980 until 2021. And there were about 24 studies that were in the literature. And in none of them, to my knowledge, after I read the article, not one was associated with an increase in recurrence of the breast cancer or any increase in mortality. We have to understand how valuable the wonderful molecule estradiol and progesterone are to our whole body economy, our mind, our sleep, our skin, our heart, our bone, our immune system. And so hormone replacement therapy of itself has been inappropriately been harmed by uninformed physicians. Let's put it that way, or maybe backed by the pharmaceuticals who need people to maybe be sick because there's no profit in being healthy for a physician anyway. Let's see. The next question, she goes on with her question, Sally does, and says, would Bi-Est, a 50-50 component with progesterone, be a suitable option for a healthy 50-year-old perimenopausal woman with no history of cancer, blood clots, and following all the recommended good health protocols? Well, yes. Bi-Est is safe and decent. I have it. I do use some of it. I tend to like just straight estradiol and separate straight progesterone because I can adjust each one. When you put them all into one thing, and Bi-Est would represent estradiol and estriol, and then progesterone added to it, then you would have three components in one delivery system, and it would be difficult to manage adjusting it when you have it all mixed together, especially starting out. But I'm all in favor of supporting natural hormones. And Marianne has the question, I was a patient of yours 10 years ago. I moved to Colorado. I have a thyroid condition, hypothyroidism. I take Armour. I also have osteoporosis. Should I be taking magnesium? I'm going to say in general, the number one mineral that's deficient in the human is magnesium. Magnesium is a tremendous cofactor like thiamine and so many other things, but we see dramatic help with various physiological functions with supplemental magnesium and multi-B vitamin supplements. And that would also go for bone building. So for my osteoporosis, I do not want to take Fosamax. I know I need to increase my exercise and weight-bearing exercise. Are there other supplements I should take? And I'm happy to say I have one patient who is a very learned woman who actually teaches biochemistry as a professorship at the university. And she is my patient. She had breast cancer. She is not going to take natural hormones. So all over the many years I've dealt with her, she did the stomping, with her feet on the ground, cement or hard surface, wearing moccasins to get that shudder up the legs. She pounded her wrist with a rubber hammer to shake the wrist bones. She took high-dose vitamin D with K2. She kept her vitamin D levels somewhere around 80 to 120 range. She stayed on a low-carb diet, so she wasn't acidic. She drank adequate water, half her weight in water. She did her, of course, weightlifting as well as resistance weightlifting, stomping, hitting with a rubber hammer, a hard surface. And she has done this over the more than 10 years. And she, even without hormones, didn't lose any bone, none, zero. And she's, I think, 74 now or something like that, 75. So it can be done. And those who can take natural hormones are going to only do much better and probably move into the normal range. So yes, make sure you're getting a high quality D3 with K2, and make sure you're getting your blood tested so your blood levels are up in the 80 to 120 range. And you're doing all those other things, eating a low carb diet, and I think you should do very well. Marianne has a question. I was a patient of yours about 10 years ago. Oh, that was her. Okay, so we have that. Now, do we have any live questions? And someone says, thank you, hellos. So Cynthia says, my granddaughter, age 18, has a tentative diagnosis of Cushing syndrome or disease. I would like her to come to TLC. In the meantime, what can we do? I love, let me see if I can move this up a little bit. Well, anyway, her diet is not good, if I'm reading this correctly. My suggestion is to go on a low carb diet, ketogenic diet, to start weight training 3 times a week, to get on progesterone day 15 through 25 of the menstrual cycle, to use DHEA 25 milligrams is my protocol for Cushingioid or adrenal gland cortisol dysfunction. Only eating really breakfasts and lunches, trying to omit dinners, so you start learning to do some intermittent fasting, a protein-rich diet, a ketogenic diet, and taking vitamin D, at least 10,000 international units a day with K2, and using water half the weight in pounds as ounces every single day, never eating late. Doing that along with, let's say, taking a good multivitamin mineral like TLC Energy Core, the progesterone cream, or you could get the balanced progesterone cream and use like 2 or 3 pumps just as over your skin anywhere on the body from day 15 to 25, and take those supplements. And along with a ketogenic diet, this should turn around rapidly and quickly. But hopefully she can get to a good functional doctor. Hopefully the lower carb, the water, the exercise, the intermittent fasted, time restricted eating range, and the vitamin D and the progesterone and the multivitamin mineral will all help her. And that's what we would do. That's our kind of standard approach for anyone with that Cushingioid. Again, I'm not trying to practice medicine over the YouTube, but that's my approach in general. But she has to be watched and managed by a functional and her regular doctor's endocrinologist, and hopefully it's not Cushingioid. So the time is 6:48. I don't see any more questions, except one just popped in, or it's a statement. Cynthia says, "Thank you. May God continue to bless you, and may God bless America and help us to love our enemies as well as our friends, and to be good because we're serving our Lord, and drive us to honor God in all that we do." And I'll end and get a little time home, and I'll look into probably everyone's on the debate today. So I hope that goes well for both and everyone involved. All right, so take care. God bless, and I'll say good night to you all. Bye-bye.